today's daily NCLEX snack. The nurse receives a report on 4 clients. Which client should the nurse assess first? We know we are being asked a priority question because it says, who should the nurse assess first? Pause the screen and comment your answer below. A client who received a dose of nitroglycerin and reports a bad headache. So in this question, we see nitroglycerin, which is a vasodilator, and a bad headache. Headaches are a very common side effect of nitroglycerin, so this is a normal finding. This client is not in immediate danger and doesn't need to be assessed first. A client with pancreatitis who reports pain rating 7 out of 10 and has a heart rate of 98 beats per minute. We see pancreatitis and pain. Pain is very common in clients with pancreatitis. Although we may need to prescribe pain medications to this client, they're not in immediate danger. A client who received a thyroidectomy with a temperature of 100.1 Fahrenheit and reports feeling anxious. This client is showing signs of a thyroid storm. After a thyroidectomy, thyroid hormone levels remain elevated, causing a thyroid storm. This is an acute, life-threatening emergency. This client should be seen first. But we want to be sure to read all the answer options because there could be a higher priority patient. So let's go to the last one. A client with a continuous bladder irrigation who reports bladder spasms. Bladder spasms can occur when a client has a continuous bladder irrigation. It could just mean that the solution is too cold, but this client is not in immediate danger. So the correct answer is number 3. The nurse should assess the client who appears to be having a thyroid storm first because they're in the most danger. An NCLEX tip for answering priority questions like this is to figure out the expected and unexpected findings in the answer options. Now, if they are expected findings, we think normal and non-emergent. But note, these findings may be outside normal limits, but are expected for the situation. Some examples of this would be COPD clients typically have oxygen saturation levels that are below normal. So it's expected that they have low oxygen saturation levels. So a normal O2 sat is 95 to 100%. But in COPD clients, it's expected or normal that they could have oxygen levels as low as 88%. Or like in this question, a client on nitroglycerin who has a very bad headache. This is a normal and non-emergent finding. This is an expected side effect. If they are unexpected findings, we think emergency. These clients usually need to be assessed first or have an intervention first. Some examples of unexpected findings would be seeing halos around lights when taking digoxin, because this could indicate digoxin toxicity. Or a patient with head trauma begins projectile vomiting because this could indicate an increased ICP, or intracranial pressure. If you see words like sudden, severe, and rapid onset, think unexpected and emergent. That's all for your daily NCLEX snack. If you want more NCLEX practice questions like this, you can sign up for the free daily NCLEX snack. This is where you get an email every morning with an NCLEX style practice question and a comprehensive review. And it's free. The link to sign up is in my bio. Happy studying, future nurses.